The Texas Medical Association's top priority during the 2011 legislative session was to protect the patient-physician relationship in every aspect of the healthcare system. When the session ended, medicine scored some important wins for physicians and their patients. Ask any legislator or physician leader about the most challenging issue this session, and the answer is the same.
Dealing with the budget shortfall.
The budget.
That's because legislators had to balance a budget with a shortfall of more than $26 billion.
Already.
Initial budget plans slashed physicians, nursing homes, and hospitals' Medicaid payments. TMA argued that not adequately funding Medicaid only drives the cost down to local taxpayers.
We were very concerned about what any cut to the physician payment rate would do to the ultimate network of physicians that would be involved in the Medicaid program.
What happens is those individuals cannot get care when they're sick, even though they have Medicaid insurance.
Lawmakers finally adopted a 2-year budget that trimmed $15 billion in current spending. The good news? Physicians' Medicaid payments were not slashed, nor were state mental health services.
So we were happy that the hardworking doctors taking care of our patients in the rural areas and in the poor areas didn't have their fees cut, and they can continue to do their important work.
I feel that we, in essence, have first done no harm. We would like to be able to say that we're enhancing access to healthcare services, but that we at least have not stepped back from some of the enhancements that we did make in previous sessions, and at least we haven't piled on any more cuts than the ones that were already incurred during this current biennium.
Instead of axing Medicaid services, legislators found savings and efficiencies in Medicaid.
I was looking for ways to do things more efficiently, to make sure that we didn't hurt patients.
One step lawmakers took was to expand Medicaid HMOs to the Rio Grande Valley. TMA worked with legislators to ensure Medicaid HMOs were held more accountable.
We've been able to patchwork together a budget that will allow the Medicaid program to continue to meet the needs of the indigent population in Texas.
The bad news is that many public health services, women's health, and family planning were cut significantly. Undergraduate and graduate medical education also took a huge cut. The cuts hurt family residency and preceptorship programs and physician loan repayment programs.
Each medical school lost almost $20,000 per student in support from the state, and our graduate medical education programs were cut, and some of the programs in Texas are probably going to have to lower the number of residents they have in their program because of that. This to us is devastating. We want to increase graduate medical education in Texas, not decrease it.
And without the residency programs, we lose trained physicians to other states.
Texas's ban on the corporate practice of medicine also was under attack. Hospitals wanted to employ doctors without any protections for independent medical judgment. Dozens of bills were filed. TMA helped lawmakers transform these bills to protect physicians' independent medical judgment in rural areas and several large hospital districts whose statutory mission is to provide indigent care.
What we were able to do this year was to craft clinical autonomy protections so that physicians are protected from corporate entities and their ability to deliver care to patients.
I think TMA was instrumental in helping us craft a bill that works well and provides good protections for patients and for physicians as well.
In no way is the hospital directing the medical practice and the responsibilities of a doctor to their patient.
Texas is the first state in the country to enact statutory protections for employed physicians. The new federal health law opened the door to explore new ways to lower health care costs while still trying to improve the quality of care. Senate Bill 7 creates health care collaboratives.
It creates I think a much more reasonable approach for doctors, hospitals, providers, insurance companies, everybody to work together for the single goal of a healthy outcome for that patient.
TMA worked with lawmakers to ensure that these collaboratives protect physicians and their patients, and to make sure that physicians have an equal share in their governance.
I think when we look back on this year, we'll celebrate the protection of employment of doctors with rules that make sure that doctors are in charge of medical care and still have an intact doctor-patient relationship, and the patients will not be treated by bureaucrats or corporations.
Non-physician practitioners pushed scores of bills seeking to expand their scope of practice beyond their training, skills, and education, essentially to practice medicine without graduating from medical school. Advanced practice nurses wanted to diagnose and prescribe without physician supervision. Physical therapists wanted direct access to patients. Chiropractors wanted their board to have rulemaking authority to do whatever they want. And optometrists wanted to be called Optometric Physicians. They also wanted to perform certain surgeries and prescribe drugs.
The drumbeat was very loud to expand scope of practice to groups who did not have an MD by their name.
We had several scope expansion bills that all the ancillary medical personnel wanted to be able to practice without oversight by a doctor.
Those decisions weren't hard for me because I would, ask them questions about training, and if the training is not at a level that I think is safe for the public, then no, we're not gonna pass that bill.
Not one scope bill passed this session that affects physicians and their patients' quality of care. Texas's immunization requirements received a boost. New vaccine requirements will protect Texans young and old. One new law, backed by TMA, requires healthcare facilities to develop and implement vaccination policies for employees.
Having a workforce that is vaccinated against these preventable diseases is an incredibly important part of delivering safe healthcare services from the hospital perspective.
Another bill requires new college students to get vaccinated for meningococcal meningitis before entering college, regardless of whether they'll live on or off campus. And physicians and other healthcare workers will educate new mothers about the pertussis vaccine, so newborn babies won't contract whooping cough. And even though the statewide smoking ban legislation did not pass, it traveled further this session than the past 3 legislative sessions. The Texas Medical Board ensures Texas patients receive quality care from qualified, competent physicians. But some people tried to weaken the medical board to allow bad things like non-therapeutic prescribing and ignore scientifically sound standards of care, jeopardizing Texas medical liability reforms. But these dangerous ideas were defeated. Instead, TMA worked with legislators to reform the board so that physicians face less bureaucratic hassle from TMB's disciplinary processes.
We were able to answer our members' concerns about anonymous complaints and make the hearing process more fair while still protecting the strength of our tort reform bill in 2003 by making the Texas Medical Board strong.
I want to be fair, and that's what this bill was about. To be fair, to give the Texas Medical Board the tools they need to discipline physicians who need that, but also to be fair and reasonable with physicians and make sure that they have their day in court, if you will. And we were able to come up with a good balanced approach.
When the session ended, physicians crossed the finish line with the reins still in hand. Even better, major steps were taken to protect the patient-physician relationship from outside interference.
The involvement of the physicians and the involvement of the Texas Medical Association is not to be underestimated. It is a very powerful force within the legislature.
I truly want physicians and TMA to know what an important role they played in the successes we had during the legislative session.
And I think when we look back on it, we'll say that was a good year.